Hello, good afternoon. Welcome to your one-stop health show, Sound Health. Today on the program, we are looking at how to accelerate eradication of HIV and AIDS ahead of the Vision 2020 set by the World Health Assembly with special focus on Lagos State. I'm Olasumbo Modupe. Welcome to the show. On innovation this week, we showcase researchers' HIV vaccine breakthrough. Please stay with us. The program continues shortly. Thanks for staying with us. It's still Sound Health on Lagos Television. Now, to discuss further how to reduce the prevalence rate of HIV and AIDS in the country with special focus on Lagos State is the Chief Executive Officer, Lagos State AIDS Control Agency, Dr. OLUSEYI TEMOWO. Welcome to the program, Doctor.
Thank you for having me.
HIV and AIDS was pronounced some decades ago. How has the country fared in the fight against this disease?
Thank you very much for having me. As you know, the disease was discovered in the early 80s. To answer your question straight away, I believe that Nigeria has done very well in the Committee of Nations in the sense that at the time it was discovered, there was no any form of enlightenment for people to even know what is the form of the transmission, what is it all about, and how do you even cure it in the first instance. So, but as of today, I can tell you confidently, as at Nigeria, the rate is about 4%. It means that when you take 100 of Nigerians, you only have 4 of them that are likely to be positive. And this was just 2014 information that I'm giving you. So I'm very sure that it must have even dropped, you know.
Would you say the level of awareness has increased in the past decades?
Yeah, obviously it has increased. And then for Lagos State, I would say it has increased significantly since I've assumed post as the executive officer of this agency. And our own focus is actually to go to the nooks and corners of Lagos State, has been directed by the Excellency Mr. Kimambodi, because he's the one that actually told us that every Lagosian must be aware of this dreaded disease. And to crown it all, because there is a massive sensation at the world level. Just 1 year ago, exactly June 2016, the Global Assembly called all the world leaders together, and my governor was part of the people that presented at that meeting. And what they said was to go and, back to the city to create awareness, and that's where we are today.
What are some of the factors mitigating against achieving a disease-free state?
The factors are, one, for us in Lagos State, we could liken into
because we have about 2.1 prevalence rate.
Yes, currently. We could liken the factors to one of the factors is probably maybe because of the education level of some of our citizens. And that's why, like I told you the other time, we are going to all the in-depths of the state, and we are translating all these things in conventional language, Yoruba, Igbo, and Hausa, because we believe Lagos is cosmopolitan. So if you hear some of our jingles, it's been translated in both Yoruba, Igbo, and then Hausa, and even Igbo language. And these are the areas that we have done. So we felt that one of the challenges is about the language level and the educational level. Those are one of the challenges. The other thing is about accessibility to healthcare, and you can see that one being addressed by our governor, where now we have in all the centers in Lagos State, we have the primary care centers. So everybody can access the HIV/AIDS testing there. And so that's one of the landmark achievements of this administration.
Okay. How often should one be tested for this disease?
Okay. For us as experts, for a layman, they refer to our testing. For us as experts, we call it counseling and testing. And the counseling will do a lot, in the sense that pre-counseling, before you even test anybody, you have to do what we call a pre-counseling session. Asking him or her what has been his sexual life and all that. And then even during the testing, you can even do some counseling as well. And post-counseling, you do it whether one is positive or negative. So to answer your question, what it means is that if you are negative, By the time you are being told that you are negative, but it's not a clean slate, it doesn't give you permission to go and now be involved in risky behavior, I believe that goes a long way. So because we have a lot of ground to cover. So for your question, we might not necessarily be saying that we have to be testing people at every maybe month or at every year or whatever. But however, as you please, you might, if you feel that maybe one of the rules they give it to you during the cancellation, you have gone against it, you could actually come again and then do your testing. But what I'm saying is that cancelling will go a long way to ensure that the testing lasts forever in everybody that is tested in Lagos State.
Okay. As an expert, what are some of the key indicators you find out in the course of counseling and testing?
One of the indicators I found out is that our people don't even know that the areas where they need to actually take caution in their sexual life, i.e. the use of condom, i.e. the use of scarification marks, i.e. you want to do circumcision for your child, some of them still practice local specialists to do it for them. So these are the areas that we discover that is very important. The important one is about what we call PMCTC, prevention of mother-to-child transmission, and that one has also been tackled by involving all the traditional birth attendants, TBA, in Lagos State, because they need to know their boundary. So if you see somebody who is positive, because we also educate them as to testing all their clients. So when they discover anybody that is positive, they send them to the referral center where you have specialists that will handle the case subsequently in terms of giving them the drug and counseling them.
Okay, talking about PMTC, before now we all know spousal or mother-to-child transmission was a big issue in achieving eradication of this disease. What's the situation now in the country or in the states?
The situation now is it's something that it interests you that in Lagos State, we have our goal now is to have a negative baby from a positive mother. What do I mean by that? Is that even if a mother is positive, we find out that most of our babies born in Lagos now, they are usually negative. It has to do with our aggression. It has to do with our well-concerted method of the control of HIV/AIDS. So what it means is that, like I said, if anybody is positive and you are a pregnant woman, you go in to assess your drugs. And when you take your drug, it means that the virus will be reduced to the barest minimum, and that will not allow the baby to be contracted with the virus. So you're going to now have a baby that will come, that will be negative from a positive mother. And of course, the mode of delivery too will also go a long way. Of course, if somebody is positive, definitely you want to deliver the baby through CS so that there will not be blood flow to the baby while delivery is occurring.
What about spousal relationship? Can a man tested negative get married to a woman tested positive?
Can confidently tell you that yes, there is hope. And what it means is that in terms of prevention and control of HIV/AIDS, when you are being tested and you are positive, once you are taking your drug regularly, the thing is that we are looking at a situation whereby we have what we call a low viral load. And when you have a low viral load, the level of infectivity is also reduced. Therefore, even when a husband is positive, the wife may not necessarily be contacted with HIV/AIDS. So that is what we are telling everybody now. And that to let you know that, in other words, HIV/AIDS is no more referred to as what we call death sentence. It's now called life sentence. So you can live comfortably, you can marry, you can decide to do anything you want to do. And even when death comes, it's not because of HIV/AIDS, maybe probably because of natural death. So to answer your question straight away, we can encourage anybody to, if once you love the person is taking the drug adequately, you may not necessarily contact HIV from there.
Okay, the prevalence rate in Lagos State is about 2.1%. We all know the antiretroviral drugs are key in optimizing treatment. How accessible and affordable are these drugs?
Well, let me start from where it's free. Nobody pays for antiretroviral drug in Lagos State. Nobody pays for antiretroviral. And I would say that the achievement is very, very good. It's very promising. We have involved community pharmacists. For instance, if you are accessing a clinic maybe near your house and there's a pharmacist there, they are usually being registered in terms of distribution for the drugs. So you may not necessarily have to go to your hospital. Once you go with your prescription, you get to your pharmacist, they will give you free in any community at no cost. So it's free. So we want to give kudos to the excellency even for making that one possible, as well as some of our partners, the international partner community, United States government. They've been involved in a lot of things, PEPRA program, FHI 360, all these people have actually contributed immensely in terms of making provision for free drugs in Lagos State.
We now have issues of same-sex marriages acting as a big challenge in the eradication of this disease. What has been your plan to bring this to the barest minimum?
For instance, male that sleep with male, we call them MSM. It's been a challenge in the control of HIV/AIDS. The reason is very simple. You know, this set of human beings, they practice what we call anal sex through the anus. And you know that anus will definitely bring about what we call blood bruises. And that will also allow the virus to penetrate into the partner. So this has been a major challenge for us in terms of control of HIV. And because of their lifestyle as well, we call them mobile individual. They don't want to disclose their identity. Some of them, they're also bisexual. So even if they have partners that are male, they still go ahead to marry their wives. And in the process of not allowing their wife to suspect them, they still go ahead to have a relationship with their wife. So it's a challenge for us to have that control. But we have a lot of CSO organizations that are also involved in terms of this awareness campaign, and we believe that definitely will curb that in, into barest minimum in Lagos State.
The World Health Assembly has set the year 2030 to beat HIV and AIDS the world over. Do you see Nigeria achieving this goal?
Well, I would say yes. Importantly, I see Lagos State achieving it because I can speak for Lagos State. Why did I say so? You know, at the beginning of the interview, I told you that His Excellency was so passionate about control of HIV/AIDS that he led a delegation of Lagos State to United Nations in US for the declaration of what you have just said. He was there and he signed it that Lagos State will be participatory state for that thing. And for us in Lagos State, I believe the roadmap is very clear. We are targeting that 2020, which means that what we call 1990 initiative. You know, and what that one means is very simple. You cannot just say you want to eradicate HIV/AIDS and if you don't have any goal, you don't have any roadmap towards that. You would need to put some measures in place. So what we are doing, that's why you see us going to all the clinical of Lagos State to cancel and test people, such that we can achieve that 1990. And what it means is very simple. We must ensure that people that are living with HIV/AIDS, 90% of them, they know their status. You know, and then for those 90% that know their status, 90% of those ones must be accessing drugs, must be taking their drugs regularly. And for those that are taking that drug, 90% of them must have what we call viral suppression, such that the virus will not be able to infect their partner or their baby, or as the case may be, anybody that's close to them. So that has been our goal. And I believe the objective is very clear. We have enjoyed a lot of support from the Excellency, and every day we have been briefing him, telling him about it. Just 2 weeks ago, we were in Ikorodu, you know, all the local government in Ikorodu to do this massive awareness of HIV/AIDS. And of course, we have what we call our mission 4x3. What it means that every 4 weeks in a month, we go to all the 3 central districts in Lagos State. So Lagos East, Lagos West, and Lagos Central to do this awareness and campaign.
In your recent campaign, do you have plans to target the less privileged in the society, the physically challenged? Because the world over now, leaders are preaching inclusive health care.
Yes, for this year budget, I want to give kudos to His Excellency Akinwambode. He has graciously approved a lump sum of money for us to screen and then to test people that are physically challenged, like the blind community, the deaf community. In fact, we are on the verge of actually commencing a massive health screening amongst those groups. He has approved it, and some people have been doing some underground work about that. So I think it's something that is in our plan for this year, and I believe we will definitely execute it because it has been approved.
Okay. What about stigmatization? How would you rate that?
I will rate it as getting almost to 0 level, because you see people now want to live, want to associate, want to cuddle with people that have HIV/AIDS, and that's why our slogan is that those that are infected and affected. As we are seated here, there are some of our relations that are infected, so definitely, invariably, we are affected. So, for example, now, if maybe somebody that is your cousin has an HIV/AIDS, you also want to share in the body. So definitely, you cannot throw the person, because we have also established the fact that touching the person, using the person's clothing does not bring you to have the virus. So the level of stigma has reduced drastically in Lagos State, and of course, there's a stigma law, that we have a booklet for that, and everybody's aware of that. And there's a sentence attached to that as well. But of course, we have not had any reason to even sentence anybody because we are increasing awareness every day. We are using opinion leaders, community leaders, religious leaders to even educate people about it. Because even there's a saying that says, love your neighbor as thyself. So why would you want to jettison the person because he's having a challenge?
Researchers at different times have come up with possible cure for HIV and AIDS. At the same time, the National AIDS Control Agency have dismissed all these claims. Is there hope for a cure in the country?
I would say that it's a hope for a cure. Don't forget that Rome was not built in a day. And for us to get to this stage where the drugs can even reduce the virus body, I would say that scientists should be applauded for that. So I believe there definitely be hope for HIV/AIDS as well. In those days, malaria used to be a problem. There wasn't even any chance of knowing whether it's going to be solved. But where you are, you just walk into any pharmacy, you can get a drug, and malaria is gone. So I believe the same thing will happen to HIV/AIDS. So I have a hope for that it will definitely.
Okay. As we end this segment, what are your final thoughts on eradicating HIV and AIDS in this part of the world?
I'd like to say that for Lagos State, I want to encourage all our citizens to come out en masse to do their testing, as provision has been made adequately in all the hospitals, in all the local government hospital, in all the primary health care board for counseling and testing them. And I will also encourage them to talk to their neighbors to do the same. For our pregnant women, they should not be afraid of doing this test because the goal of us in Lagos is that we want to have a negative baby from a positive mother. So my final note is that all Lagosians must respond to this target that we have, and that is having 90% of Lagosians to be aware of their status towards eradication by 2030.
Thank you so much, Doctor, for sharing your expertise with us on sound health.
I want to thank you for having me on the show, and I want to also encourage you as a journalist to help us to push the awareness further, such that our goal in Lagos State is to have a zero tolerance for HIV/AIDS. Thank you very much.
That has been Dr. OLUSEYI, the Chief Executive Officer, Lagos State AIDS Control Agency, on achieving HIV-free state by year 2020. Sound Health continues with trending and home essentials. Please stay with us. Thanks for standing by. It's still Sound Health on Lagos Television, and I'm Olasumbo Mudupe. On innovation this week, we showcase researchers' HIV vaccine breakthrough. That's in a moment. Please stay with us.
medical researchers have developed a therapeutic vaccine that could defeat HIV. Unlike conventional vaccine which prevents diseases, a therapeutic vaccine helps equip affected bodies to defeat a disease that is already being contracted. Around 1% of the population have innate immunity to HIV. Their bodies can fight the disease without the need for drugs. A functional cure is where the patient doesn't suffer any of the problems associated with HIV, but there may still be traces of the virus in his or her system. HIV infects some of a person's white blood cells that normally helps protect the body against illness. Once the immune system is compromised, an infected person is at risk of dying from such diseases as tuberculosis, pneumonia, or the flu. The process requires a two-step process. Firstly, the vaccine boosts a patient's immune system so it is better able to fight the virus. Then the patient is given a drug called romidazepine, which causes the HIV-infected white blood cells to release proteins on their surface, identifying them to the body. The patient's white blood cell boosted by the vaccine are thus able to find and destroy the HIV-infected cells. A group of scientists ran trials of the vaccine on 13 people who had recently contracted HIV, with the aim of helping their immune system find the HIV-infected cells and destroy them. Once the patients received the vaccine, they stopped taking their antiretroviral treatment and began taking romidazepine to see whether their immune system could defeat the disease, and the results were encouraging.
That's Sound Health this week. Please know your status by getting tested early. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.